Alright, so we're about to finish the liquid facelift. This is part 4 of our individual little videos. The first video we did a little bit of a nose job on her, and the second video we did her upper and lower lip, and third video we did the left side of her face where we did a little bit of a cheek augmentation with the filler. And now we're finishing up the right side to match the left. And we're not really using a lot of filler in her. She wants just kind of a little subtle result without too much change, which is good. So we're using a total of a little over 2 syringes. She had a little bit of 1 syringe left over from a previous treatment that we used to put a little bit in her nose. We've already done her lips, so her lips are looking nice, and you can see that afterwards she really doesn't have any bruising. She bruised a little bit from the very first one we did, but didn't bruise from the second one, so every now and then somebody bruises a little bit, but usually not too bad. Put just a little bit more in this area here. You feeling any of this?
Mm-mm.
And that's the ideal, or the advantage of the numbing shot is that the patient really doesn't feel anything at all. Every now and then they feel a little pressure. Alright, tilt straight for me there. Let me see your face. Okay, lean forward now. Alright, again, like we did on the other side, you can see where she's just starting to see a little bit of falling of the cheek here. So we're going to put just a little bit of filler here. This is something that most people that use fillers don't do because they're not real experienced with it. You can see that she felt just that initial little poke. But other than that, the rest of it wasn't too bad. And we'll just massage that in real nice. We put this in the deep part of the tissue so that you can't see any of it. I'm going to put just a little poke, one little stick. And for the purpose of the video, this is a real patient. This is a real paying patient. And you can see her responses are very minimal to any of the sticks, so you can see how easy it is to tolerate it. Downtime is very, very minimal on this, and looks like she's already stopped bleeding a little bit on the other side. She had one little spot where she bled just a little bit over there. And I always take my time and make sure we hold pressure and everything really good afterwards so we minimize the risk of bruising. Put the last little bit right there. We are all finished. I'll make one little final check here to make sure everything's smooth, so open up for me.